Dr. Sturtz, you served as the chief toxicologist for Pfizer Europe. Is that correct?
Yes, that is correct. There I was responsible for all animal experiments that served to ensure the safety of medical devices.
Thank you. My questions relate to Kuminati from Pfizer BTech. You have intensively engaged with the approval process for this vaccine, including a thorough review of the documentation. Is that correct?
That is correct.
Was the carcinogenicity of this vaccine checked before approval?
No, the carcinogenic risk was not investigated due to time constraints. It strikes me, incidentally, as very worrying and frankly regrettable that no investigation into possible alternatives was carried out.
In Germany, but also in many other countries, we have observed that the birth rate collapsed after the vaccination campaign.
Well, you are referring to studies on reproduction. A flawed study using Comirnaty was conducted on a group of rats. This made it impossible to conduct any reliable assessments of the vaccine's impact on pregnancy or on the child's subsequent development. Nothing had been learned from the catastrophe. According to the RKI protocol, approval was granted in fast-track processes. It followed that crucial toxicity tests were sacrificed in favor of speed, and this sacrifice lacked any acceptable rationale. I am not aware of any case in which all these studies were omitted for a comparable indication, however. The approval led to prohibited human trials.
The RKI noted internally at the time that side effects and vaccine damage should only be examined after the vaccine was launched on the market. What was the outcome?
In Pfizer's post-marketing surveillance report, over 1,200 suspected death cases were recorded within just 2 months following the drug's approval. Comirnaty should have been withdrawn from the market by then at the latest. If I am correctly informed, the Paul Ehrlich Institute has received 2,133 reports of deaths after Comirnaty to date. These spontaneous reports have a high number of unreported cases due to underreporting. The real number is therefore much higher. In the USA, it is assumed that there is underreporting due to an underreporting factor of 30, but which the registered cases would have to be multiplied. For Germany, this would correspond to 60,000 deaths from the vaccination.
60,000. Therefore, the German federal government is withholding vital SafeWac and KFD data concerning vaccine side effects, and the majority of this commission has even declined to request this information. Could vaccine injuries and deaths have been prevented if the vaccine had been approved in accordance with the rules?
Yes, because in accordance with the rules, Comirnaty should not have been approved at all.
Many people in Germany who suffered injuries due to vaccinations are currently fighting for compensation for pain and suffering, and they often lose because the courts say that Comirnaty has a positive benefit-risk ratio. Is this assumption justified?
In my opinion, not at all.
Comirnaty was not investigated at all during clinical development for the prevention of severe diseases or deaths. The Pfizer documents, therefore, do not indicate a positive benefit-risk ratio at all. Mathematician Robert Rockefeller from the University of Koblenz estimates that for every severe course of COVID that Comirnaty supposedly prevents, there are 25 serious side effects. Okay. Has the age-adjusted mortality rate in Germany increased since the start of this vaccination campaign?
No. Mortality increased significantly from 2021 to 2022 compared to 20. With a positive benefit-risk ratio, mortality should have decreased when the vaccine beginning of 2021. That makes sense.
Did the population receive the active ingredient that Pfizer tested in the shortened emergency approval procedure during the vaccination campaign? No.
A highly pure substance was used for the clinical trial prior to approval. It was too expensive for mass production. The entire population was administered a vaccine that was manufactured using the bacterium Escherichia coli. The result is significant contamination with bacterial DNA, and the consequence could be a significantly increased risk of cancer.